So at Wirral Hospital Trust, we've got a very long history of electronic systems. We've been using electronic systems for patient care now for probably over 25 years, and we've just finished the programme to replace all of our legacy electronic systems with Cerner Millennium. And that's been a programme that we've been running since January 2009, and it's just come to an end. So we now have Cerner systems virtually everywhere across the whole trust, and it's used to provide virtually all of our patient care. So we're now in a position where, having finished that, we've been lucky enough to be made one of the Global Digital Exemplars for the NHS in England, which is fantastic. And it does mean that now we can, for the next 2 years, work on improving what we've already got live in the hospital and refining it and making it better. One of our unique selling points, I think, is the fact that we have already started doing population health management supported by IT across the whole of the Wirral, so with all of our health and social care partners on the Wirral. And this, the Global Digital Exemplar status will allow us to continue that and improve that over the next 2 years, build on what we've already done. So that's fantastic news. I think the staff within the Hospital Trust are generally quite proud of their IT systems. I think for a lot of them, because our staff tend to stay put because we're a peninsula, we don't get a lot of movement in and out of the hospital in terms of staff turnover. So for them it's just what they're used to, they've just always had it. But I think those that have worked in other places, especially our junior doctors, are very appreciative of the fact that we've got such great IT in the hospital. And I suspect that everybody in the Trust is really proud of the fact that we've got the Global Digital Exemplar status. We've got a very busy 2 years worth of work. A lot of it is about building on what we've already done within the hospital. So we want to put far more electronic pathways of care in. We want to reduce clinical variation through the use of those pathways and through decision support. We want to incorporate far more of our images into the system. And a whole host of different things that we want to do in the hospital, including closed-loop medication administration as well. And then a big part of the Global Digital Exemplar programme is going to be about developing our population health management system. So this is combining data from the acute trust, from the GPs, from social care, from the community trust, from all of our partners on the Wirral, into one single record. So that's the unusual bit in this. We're not just bringing data together and making it visible. We are creating a whole new record by combining that data into a single longitudinal record for each patient, and also producing registries, so allowing us to monitor how compliant patients are with a set of measures for a particular condition. So far we've done diabetes, asthma and COPD. And we have plans to do another 6 registries before the end of the year. And all of this, of course, will only work if you can do the transformational change to make people use the registries and use the record that's available to them to really change the way that patients are cared for and to improve the long-term health outcomes for the people of the Wirral. So I think the patients within our hospital already notice the technology that we use, and they'll notice that there's more of it and that they're probably seen far more efficiently, so the flow through the hospital will be far more efficient. For patients in the wider Wirral, I think they'll start seeing the difference because they will start getting targeted health interventions, which we can drive through the registries and the compliance against the measures. So we can start actually targeting exactly what each patient needs to keep them well. So for example, for a patient who's got diabetes, there are a set of things that have to happen to keep them well. And for example, they need an annual foot exam, they need their eyes checked, they need the blood pressure taken, they need their body mass index monitoring. And at the moment, all of those things are done in isolation by the different health agencies. But if we're using population health management, it doesn't matter where the patient touches the health system or social care, they'll know what the status of the patient is and what they need, and they'll be able to offer it straight away, or at least put them in touch with somebody that can make sure that they've got all their measures completed. So I think it's great that in the Northwest we've got 4 of the 13 Global Digital Exemplar sites. So there's 3 in Merseyside and Salford that aren't very far away as well. And I think that's fantastic for this area. It really goes to show that we're leading the way in digital innovation in healthcare.